Pulmonary bursts, part 5. Lymphocytic pleural effusions are most commonly seen in what two conditions? Lymphocytic pleural effusions are most commonly seen in number 1, TB, tuberculosis. Number 2, malignancy. Now let's talk about adenosine deaminase, ADA. So adenosine deaminase can help you diagnose this type of pleural effusion. TB, right. So it's actually better at ruling out TB. So if a lymphocytic pleural effusion is not caused by TB, the pleural fluid ADA level is almost always below 40. Okay, 40 units per liter. So it helps you rule out TB. So it's a sensitive test for the diagnosis of TB, right? So negative tests rule out a disease. So a negative ADA, meaning less than 40 units per liter, rules out TB in the pleural fluid. Okay, so that's adenosine deaminase. All right, let's go to the next. When should you perform a follow-up CT in a low-risk patient found to have an incidental pulmonary nodule of 3 millimeters? So asymptomatic, low-risk patient has an incidental 3 millimeter nodule. So when does this patient need follow-up CT? So the patient does not need follow-up. Wow, interesting, right? So do we do this in practice? I guess I have no idea. So it's probably easier said than done. You know, when you're looking in the face of a 4 millimeter pulmonary nodule. Wow, this is interesting. So, you know, my guess is people are probably following these. So let me read this. So according to the Fleshner Society recommendations, no follow-up is needed for low-risk patients with nodules 4 millimeters or smaller. Okay, now follow-up CT at 12 months would be recommended for patients with nodules less than or equal to 4 millimeters who are at risk for lung cancer. So there you go. So it's not cut and dry. So if you really want to get that CT, I guess you can. You just have to have a reason why you think this patient's at risk for lung cancer. Okay, let's go to the next. All right, an increase in plateau pressure represents what? An increase in plateau pressure. I'll give you some choices here. So does an increased plateau pressure represent an issue with resistance, compliance, or both resistance and compliance? An increased plateau pressure is a compliance issue. It's always a compliance issue. Now what about this? What about an increase in peak pressure? Okay, same choices. Does an increase in peak pressure represent an issue with resistance, compliance, or both resistance and compliance? So an increase in peak pressure can be from both, right? So an increase in resistance can raise the peak pressure, and a decrease in compliance can raise the peak pressure. And you can certainly have two things going on at once, right? A simultaneous issue. So a few take-home points. A decrease in compliance will raise both your peak and plateau pressures. Okay, that's number 1. Take-home point number 2. A rise in plateau pressure is definitely due to a decrease in compliance. Take-home point number 3. A rise in peak pressure can be due to many things. So for example, a rise in resistance, or flow, or an increase in tidal volume, or a decrease in compliance. Okay? And the last take-home point, if your plateau pressure rises, your peak pressure also must rise. All right, so a lot of stuff you have to know here, but it's all important. Okay? So let's do a couple questions. Bronchospasm. So will a bronchospasm increase your peak pressure, plateau pressure, or both? So bronchospasm will increase the peak pressure only. Why? So because bronchospasm, it increases airway resistance. It has nothing to do with the compliance of the lung or the thorax. Okay, let's do another one. Will pulmonary edema increase peak pressure, plateau pressure, or both? So pulmonary edema will increase both the plateau and peak pressure. Okay, so pulmonary edema decreases compliance unless you get an increase in your plateau pressure and your peak pressure. And remember, if plateau pressure increases, your peak pressure increases. So it's easy, right? Right. All right, let's go to the next. Name some causes for a decreased pulmonary compliance? And there's going to be a lot. Okay. So causes for decreased pulmonary compliance, and hence an increase in plateau pressure and an increase in peak pressure. So pulmonary compliance, it's decreased by any of the following, and I'm gonna do this systematically. Okay, so we're gonna work from the alveoli outward. So here we go. So causes for a decrease in pulmonary compliance, starting at the alveoli. So within the alveoli, you can have pulmonary edema, you can have blood, you can have like ARDS, anything that can plug up the alveoli. Okay, now moving from the alveoli outward to the interstitium, you can have a fibrotic process going on, you can have CHF, and moving outward even further, you next go out into the pleura, so a pneumothorax, pleural fibrosis, and moving from the pleura to the thorax. So the thorax is what? Thorax is bone and muscle. Okay, so maybe severe trauma, morbid obesity, things like that. And then even outside, moving outside the body. So I remember as a medical student, the anesthesiologist would look over at me after the peak pressure was up on the screen. Okay, they'd look over at me, they'd see the peak and plateau pressure were up, and they'd see me leaning on the patient. Okay, so leaning onto the patient, it's just like having a lot of body fat. Okay, and the anesthesiologist knew, right? And likewise, I should have known better myself. So for every reaction, there's a reaction. It's all Newtonian physics. So less pressure on my feet meant more pressure in the plateau pressure, pulmonary. Okay, so a lot of causes for decreased compliance. Okay, and again, systematic approach to that is probably going to be the most useful. And you can start from the alveoli, work your way out, or you can work from the thorax in. All right, last question. Strictly memorization here. Ready? Advair. So Advair contains 2 inhaled medications. What are they? Advair contains salmeterol and fluticasone. So salmeterol is a long-acting beta agonist, and fluticasone is a steroid. And what about Symbicort? So what 2 medications does Symbicort have? So again, formoterol, which is a long-acting beta agonist, and budesonide, a steroid. So Advair and Symbicort. And that's it. So thanks for coming. Hope to see you again. Goodbye.